and assist as volunteers to take care of those who eventually fall unwell. And so I appeal to them in a very special way to take this responsibility in the seriousness that we must. Yani, nataka kusema, mimi nataka kuwasihi vijana na wasichana wetu tujitayarishe kulinda hii nchi yetu kutoka kwa hii virusi. Kila vizazi ama generation, kila vizazi katika maisha hii yetu tangu uhuru wetu, kila vizazi imepatiwa kazi yao na Mungu mwenyewe, na vizazi hii ya leo imepatiwa jukumu la kupigana na hii virusi, ndio Kenya yetu tusije tukaisha. Nyinyi mnajua kujipanga, mnajipanga katika matatu, mnajipanga na uongozi ambao tumeona kwa sisi, kwa nyinyi wenyewe. Tusipofanya hivyo, wale ambao watakuwa na shida kubwa ni nyinyi vijana, ambao ni watoto wangu na ni watoto wetu. Ni nyinyi ambao mtaanza kuwa na shida ya kuangalia mtoto akiwa mdogo na hana chakula, ama wewe mwenyewe una kazi, kwa sababu uchumi wetu utaathirika na kufa. Ni nyinyi vijana wetu ambao tusipofanya vile tunasema, mtaanza kuwa na wazazi kama mimi na wengineo ambao watakuwa wagonjwa. Na mzazi, wale wazee, mzee hawezi kuchunga mzee, ni vijana wetu wataanza kutushunga sisi wenyewe. Na tukiendelea hivyo, tusipojihadhari, basi nyinyi vijana wetu, vijana na wasichana wetu, nyinyi jukumu lenu ndio itakuwa kutuzika sisi wazazi wenu. Na mimi nafikiria hakuna muyouth hata mmoja anaweza kutaka ama kupenda kuwa na hiyo kazi ngumu sana. Kwa hivyo jameni, mimi nawasihi sana, tujipange kwa mitaa vile tunajipanga kazi ingine. Tujipange kuangalia kwamba watu wasikabiliane. Tujipange kwa masoko, ndio watu wakiambiwa watumie vitambaa, mchikane na polisi, mfanye kazi pamoja kwa wakati huu, msaidie wafanyikazi wa afya. Ndio nyinyi sasa muwe katikati ya kupigana na hii virusi. Kwa hivyo leo nilikuwa na hiyo neno moja, nilikuwa nataka kuzungumzia youth wetu, nilikuwa nataka kuwasihi, nilikuwa nataka kuwaomba nyinyi muwe katika vita hii na njia mpya ya kupigana na hii. Kwa sababu mimi nikisikiza na nikitembea katika masoko, wale ambao hawashukui hii maneno na ngumu, naona kama ni vijana na wasichana. Chukueni hii kitu na nguvu, ndio tuweze kupigana na hii epidemic ama hii virusi. Ladies and gentlemen, over the last 24 hours, we have tested over 300 people for coronavirus. Out of the 372 samples that we have taken, 4 have tested positive for the disease. The 4 are 3 Kenyans and 1 Pakistani national. In terms of gender, we have 3 who are male and 1 who is female. 2 of them traveled from Malawi and Pakistan respectively, while the other 2 contracted it locally. Their ages range from 34 years for the youngest and 44 years for the oldest. Out of the 2,050 individuals who have been in mandatory quarantine, 1,866 have so far been tested, and we are remaining with 184 individuals. Contact tracing remains the largest activity that we have right now, and about 1,781 contacts have been monitored. We have managed to discharge about 1,100 people from our follow-up program on the expiry of 14 days. Currently, we are also monitoring some 672 people in our follow-up program. Ladies and gentlemen, we have had cases of people testing positive in our quarantine facilities. Indeed, currently, they rank among the highest. This is likely to pose a risk of more transmissions, especially among those who have been sharing facilities or those who have not taken seriously the distancing requirements. As I said earlier, there are those who actually went on partying sprees in quarantine facilities. This is against every protocol that we have issued. But in a bid to further contain any transmission arising from those in mandatory quarantine, we have instructed our medical teams to extend quarantining those in facilities which we believe have got individuals who need another 14 days, given the fact that the contacts that they have within the quarantine facilities have tested positive. Now we appreciate that this is going to be very inconveniencing, to quite a number of people, and we apologize in advance. But to secure Kenyans, it is an activity or a position that we have regrettably had to take. What I would like to appeal, even to those whose quarantine period has been extended, and it is not all those who are quarantined. It is only in those areas where our medical personnel feel that it is necessary because of the contacting that has been going on in those facilities and the discovery of positive cases in the same. So what I would like to appeal is that those in quarantine facilities, please understand, the whole concept of quarantining you is so that you can stay away, keeping your social distance, reducing contacts as much as possible, so that whatever status you have remains yours alone. The reason why those people are quarantined is because we suspect that some could be positive because of their travel. Consequently, we urge you, those of you who are in quarantine facilities, we urge you that you do exactly that, quarantine yourself. Finally, I also want to talk to the issue of gatherings. For some odd reason, there is a relaxed atmosphere about people who are gathering in groups. And I want to once again stress that there is a government directive in accordance with the Public Health Act that we should not gather anywhere. We were even hearing rumors about a group of over 6,000 people who wanted to gather somewhere in this town for some odd reason. And I would like to say that such a gathering will not take place. So let's be reasonable. I appeal to Kenyans to adhere to the rules so that enforcement becomes unnecessary. We are thankful to those who continue to obey the guidelines that have been given, the guidelines regarding curfew, the guidelines regarding social distancing, the guidelines regarding hygiene measures of washing your hands. We are grateful that you are doing that, and you like to urge that you continue to do so. And you like those who are not, you like to appeal to you to desist from any defiance of the rules that are made so that we can save Kenyans. Thank you very much, ladies and gentlemen. Okay. First of all, we are lucky, in a sense, Purity, that the numbers are not increasing at an increasing rate. At least today's numbers, as you saw, were actually less than. In this week, I think this is the lowest number, in spite of the fact that we have increased testing. So we believe that the measures that we are taking are having effect. The less let's not forget, the whole thing about curfew, or even what you are hearing people talking about lockdowns and distancing, the whole idea is to create social distancing or physical distancing, as it were. That is the whole idea. Even when you hear of lockdowns, the thing, a lockdown is where there is extreme distancing, forced extreme distancing. That's what it is. So a curfew, in effect, is a way of ensuring that you reduce those numbers. So we are confident that it's having an effect. And you know, the irony, and what you must keep at the back of your mind is this: when something does not happen, when people do not get, if we save people from becoming positive or turning positive, what we will never know is what would have happened if they did. In other words, when we talk about the effect of a curfew, what you don't know is what may have happened had we not had the curfew. This is the figure that you must always keep at the back of your mind, and it is something that usually people won't think about. Next. There is Kennedy. You will have to wait. Asante sana. Okay. First, I think there is. Let me correct you. Let me first start by correcting you. That even if I think indeed it was in yesterday's paper that they advertise the various categories of medical personnel, clerical officers. I mean, not clerical, the clinical officers, nurse grade this, and so on and so forth. That's number one. So it has already started. This has already started. And in fact, what we have said is that the county service boards are the ones who are going to appoint those people even at the county levels. And we have the hiring of the doctors and nurses at the various hospitals has already started. In fact, I think KU has already hired over 100 of them. And it is going on even as we speak. The second thing is this: do not underestimate the ability of our people. Do not underestimate the ability of even our third and fourth year students, to take care of themselves, to fight for themselves, and to ensure that they are not exposed. You know, because, you know, we talk about these things as if, you know, we are talking about some helpless people, you know, who are unable to speak for themselves. They are very able to speak for themselves, and they are the first ones on the line. And I can tell you that we are also involving them in ensuring that the protective gear that I spoke about is for them. This protective gear, we are saying, we do not pass anything until the doctors themselves, you know, have agreed and accepted that this is a good quality gear. So in terms of taking care of them, we can do better. You know, nobody has said that we are doing, we are operating in ultimate goodness. We can do better, and we are striving to do better. I know that the Ministry of Public, the Public Service Commission is working at seeing how we can improve their welfare, even as they continue to be our front line soldiers. My ministry is looking at how to secure them from any infections. So they are at the top of our minds. The Acting Director General here is the chair of a team that is working on nothing else except the protection and the welfare of our medical workers. And I want to thank them and continue to thank them.
Thank you very much. My name is Cabinet Secretary Mutahi Kagwe. One of the things that I would like a clarification from you, Bwana CS, is the question of those in quarantine and the extension of days. One of the things that you have alluded to is that there is a probability that they brought this on themselves by the spirit of party. But then there is another question that is coming from those who are in quarantine, where they're even saying that there is no social distancing in the way that they are put in on this route. Then there is the question of calling on the youth to take the steps of making sure that we fight this. I am a youth and I'm going to call to hit this call. But then again, there is the cases that we've even seen in Kisumu, where these youth, some of them are even beating up the border people. Some of them might even take your call in the form of forming vigilantes. How are we going to make sure that we arrest this? There's a question of...
Thank you. Hey, Muredi, you are giving a speech now. Thank you very much. Thank you very much, my friend. Let me just say this. First and foremost, our appeal to the youth is not one that calls for vigilante groups. It is one that calls for cooperating and working through our security agencies, working with and through the security agencies to ensure that they themselves are on the front line of good behavior. That is the first one. So it is no call, and even Kisumu indeed, there are some people who are misbehaving. That has nothing to do with our call. And that has nothing to do with anything else. That is basically lawlessness. And that is not what we are calling for. As for the quarantining situation, you know, we started off by saying that it's a personal responsibility. There is a personal responsibility to each and every person to ensure, you know, we cannot police distancing. It is very difficult for a person to be followed, each person to be followed all the time, to see what distance that they are keeping from the other one. It's a personal responsibility. And therefore, you can only take responsibility for yourself. And I would like to appeal here, please, don't wait until you get positive, and then you start blaming government because you have turned positive. While we have been singing, appealing, begging that people keep social distancing. Last one. Okay, there are two questions. Thank you, Shimtai. What I said was, number one, is that we have operationalized KU. KU is a huge facility. Those who are there and those who have been hospitalized there before are not affected by this at all. So they will continue there. What we are not going to do is that we are not going to admit new cases of a regular nature in KU. And on the issue of distribution, there are many sources of the masks. What I said was the ones we have, we are going to distribute to the through the county governments, through the CECs responsible for health, which then they will pass them on to the chairman of the various organizations, the matatos, the border borders, and so on. But we are not saying that people should be sitting around waiting, for masks to come to them. Wananchis now have been given freedom, to make them, and we have said these things should be made as cheaply as possible. As you have seen, people are even producing their own for a shilling, and so on and so forth, provided they are following the laid guidelines. So going forward, we'll expect, for example, that when the supermarkets are giving masks as people enter, and the experience we have seen over the last couple of days is that people are not even waiting to be given these masks. They are acquiring them for themselves because it is your own safety. It is not the government's safety. It is your own safety. So we will distribute as many as we can. We are continuing to do so. Fortunately for us, we don't have to import them anymore. We are making them locally now. Just as I said, just one institution in Kitui is manufacturing 25,000 of them per day. So we are not worried about getting, and also it's business for a lot of young people, a lot of young tailors who can now be able to manufacture them. You saw some very fashionable ones being made. And we are all for fashion, but I hope they also work. Thank you very much. There's
okay, my name is Gloria. I'm from KU.
Yes, Gloria. Okay, I will leave the gender explanation to the authority who knows it because I don't know. But on the issue of the quarantine, we have made it very clear that you are quarantined at your own cost. We as a government are going to help, and we have committed ourselves to helping because we must. And we are also a responsible government. And we have said that we will do that, but perhaps that will be done more on a case-to-case basis. Some people can afford it. Some people can quarantine themselves in very expensive hotels. Others can't. So for us, is to take care of the least able. Thank you. Agenda.
I can't speak with this one. Thank you. The question of agenda, if you look at statistics starting from China, where the problem began, to Italy, Spain, United States of America, Germany, all over. Apparently, this virus has a predilection for men compared to women. Even if you look at the number of people in our quarantine facilities, it is more men, 57%, and 43% female. I just want again to emphasize what Waziri has said in terms of this extended mandatory quarantine. If you don't behave, then you will suffer the consequences. We are making good progress, but we have not turned the corner yet. If we continue the measures that we put into place, we are confident that our numbers will be manageable. In terms of the age distribution, again, I wanted to emphasize our youngest case has been 2 years, and the oldest is 71 years. So as much as you want to ensure that the personal hygiene for adults, please don't forget about the children. Ensure that they also wash their hands. Ensure that they use the sanitizers. limit their play with their friends outside as much as possible. So far, our case fatality rate is about 3%, which shows that we are making some progress. If you compare to what is happening like in Italy, Spain, and United States of America, where in the past 24 hours you have had more than 1,400 deaths. It means that if we take these measures that we preach each and every day and put them into practice, then we can be able to overcome this challenge. And my appeal to Kenyans is that tough times lie ahead. Let us not lower our guard. Together, if we work like we are doing, we shall overcome. Thank you.
You ever heard the saying, never rob a bank across from a diner that has the best donuts in 3 counties?
That's not a saying.
Yes, it is.
No, it's not. I get what you're saying,
Maybe
but
you
it's
never
not
heard.
a saying.
It is a saying.
Okay.
It's a saying now. Everybody sit down on the floor.
Fire in the hole! Let's go, come on! How much you figure?
40 million.
$40 million?
But I got bad news for you.
He was special forces.
You've been on this limb way too long.
Pull over! Did you miss me?
What's your plan?
I got a plan. I mean, I'm capable of coming up with
I'm
a
not saying you're
plan.
not capable. I'm just saying you haven't told me. What is it?
I'm working on it.
Make it rain.
This weekend on KBC Channel 1.
Tuona kwa shamba yetu bila kutoa lolote. Ariri, usilie. Hii ni mitihani tu.
Mimi naomba ruhusa nende nikapumzike, maana nasikia vibaya.
Mama Dama, si nishakwambia umsamehe.
Yusuf, wewe umepataje hii?
Dad, mimi si CID. Mimi ni lawyer.